Good day everyone, my name is April Geraldine Legara Cabahog and I will be presenting about the guidelines on handling blood specimen. So the importance of knowing the guidelines of handling these blood specimen is to maintain a standardized collection procedure that will help reduce pre-examination errors that can cause inaccurate test results and can result in patient harm. So the guidelines are in the following. First is before collecting blood samples, read the instruction carefully and ensure that appropriate tubes and labels are available. Errors in specimen label led to a higher number of inaccurate test results, which can delay a patient's result and treatment option. Second is to greet the patient. This is to show respect to the client, and also greeting is one of the most basic functions of communication and can trigger positive conversations. It helps us connect to people in a more personal level. Third is to inform the patient about the procedure. This is for the client to be aware what will be the procedure and also has a mutual understanding between the two. Fourth is to assemble all materials and place tubes within arm's reach. This is also to avoid being messy, and it also gets the equipment on reach for the healthcare professional. Fifth is to use an alcohol wipe to sterilize the puncture site. Wipe the area thoroughly with a sterile gauze pad. Alcohol swabbing before an injection is a long-standing, widely used infection control practice. It is a thought that prepping the skin using alcohol swabs remove bacteria that could be pushed into the puncture and might cause an infection. Sixth is do not touch the site after cleansing. Seventh is it is essential to remember the blood should not be forced through the needle or tube when using a syringe or needle. Next is to put gloves prior to venipuncture. This is for the safety for both parties. Next is to apply tourniquet and perform venipuncture and phlebotomy on the patient. Next is if blood is placed in the incorrect tube, new sample must be taken. Do not transfer the tube to the correct tube. This is to avoid cross-contamination of the sample by additives found in different collection tubes. Next is needle and lancet should be used only once before being discarded in sharp containers to prevent contamination. This is also for cleanliness. Lastly, after the blood has been drawn, remove the tourniquet, apply direct pressure and a bandage until the bleeding stops, and remove gloves and wash hands.
Good day everyone, I am Krisha Sibalaga, and for our case, we have our patient, Mrs. NRT, a 23-year-old female in her 9th week of pregnancy who is diagnosed with hyperemesis gravidarum. Is hyperemesis gravidarum? Hyperemesis gravidarum is a condition experienced during pregnancy that involves extreme morning sickness, nausea, vomiting, and weight loss as its major symptoms. It is thought to be a result of pregnancy hormones, but its exact cause is not known. Therefore, what health teachings can we give to Mrs. NRT? So, as a student nurse, we must advise our patient to rest and eat small, frequent meals that are very high in carbohydrates and low in fats. Foods such as oatmeal, whole grain pasta, whole grain bread, or minimally processed breads. Mrs. NRT must also limit her greasy or spicy foods intake, and foods or others that causes symptoms should be avoided as well, such as liver and onion. We must also advise our patient to drink plenty of fluids, such as water, and sipping them little and often may help prevent vomiting. And Mrs. NRT must also or may also eat foods or drinks containing ginger because it has shown evidences that it reduces nausea and vomiting. So those are the health teachings we can give to patients who are experiencing or diagnosed with hyperemesis gravidarum such as Mrs. NRT.
Good day everyone, I am Hans Miguel Amparo and these are the laboratory test results, its significance, and the health teaching. So for the interpretation of the patient's result, For the hemoglobin, it's 10.2, hematocrit 30.7, red blood cell 3.12, white blood cell 8,180, MCV 98.4, MCH 32.7, MCHC 33.2, platelet count 214,000, RDW is 12.40. So for the differential count, the neutrophil is 79, basophil 0, eosinophil is 1, lymphocyte is 14, and the monocyte is 6. So for the clinical significance reading, the patient's hemoglobin is not getting enough oxygen in her body since her hemoglobin is low. Same as the hematocrit, since it shows a decreased count, the patient has anemia. For the patient's red blood cells, the test results also show a decreased RBC count, which indicated the risk of folate deficiency or lack of folate acid in the blood. But so far, the patient's white blood cells, MCV, MCH, MCHC, platelet count, RDW, neutrophil, basophil, eosinophil, lymphocyte, and monocytes are all normal. So as I have mentioned a while ago that the patient has anemia due to the decrease of hemoglobin, hematocrit, and RBC. The best way to prevent anemia is to eat iron-rich food like chicken, fish, eggs, dried beans, and fortified grains. It is also important to eat foods that are high in vitamin C like citrus, fruits, fresh and raw vegetables. And if there is a need to take iron supplements, it is better to visit a doctor or a hematologist so that they can give more advice about having a healthy diet and prescribe some iron supplements that will help the patient improve her health. That's all. Thank you.